While vast swaths of the healthcare sector have just been hammered of late, the medical device stocks have mostly hung in there. They're doing pretty well because they're not hated by the public like the drug companies or the managed care places. Take Hologic, a company that makes top-notch diagnostic equipment, medical imaging systems, surgical products, and light-based treatment systems with an emphasis on women's health. A few weeks ago, the stock was setting new all-time highs of 48 and change, but recently it's pulled back a bit. Last night, Hologic reported what looked to me like a pretty good quarter. Modest top and bottom line beat with solid guidance. However, Wall Street's reaction, let's say, was a bit confused. And just as the stock got hit, then it rebounded, erasing the losses. What do we make of this? I think we need to do some more homework. So on the eve of National Women's Health Week, let's check in with Stephen McMillan. He's the chairman and CEO of Hologic. Learn more about the quarter, where his company's headed. Mr. McMillan, welcome to Mad Money. Good to see you, sir.
Thank you, Jim.
Have a seat. Thank you. You know, the vast majority of my staff is are female.
So, very good.
Yep. And, well, we've got the floor, but
couple of daughters
research,
as well, right?
indeed. And they all cheered that you came on because they feel that not many companies actually address women's health needs. And as I studied for the piece, I have to admit that Hologic is pretty much your main emphasis.
Well, we happen to think we've probably done more for women's health and especially breast and cervical cancer than any company on the planet.
That's my read after I talk about. You should talk about some of the inventions you've had and some of the things you're doing, biomarkers, what you're doing for just everyday women. National Women's Health Week coming up.
Yeah. First, thanks so much for having us on, especially ahead of National Women's Week. I think the biggest thing and one of the most visible things right now is certainly our 3D mammography. And if you think about it, we invented 3D mammograms, launched first in the United States in 2011, didn't fully really take off until kind of the 2015, 2016 time period. And today is in more than half the hospitals in all the country and, frankly, expanding very quickly around the country. In simple terms, the great thing about our 3D is it improves the detection of cancer up to 60%. And the early stage cancers, but also what it's doing is it's reducing false positives. So you think about one of the big problems, right, in imaging is you get these positives and then you've got to go in and have a biopsy that isn't needed. So our 3D mammography has really been pioneering and opening up so many new avenues, really particularly in women's health.
And I know for shareholders, you're talking about Genius 3D, you said on the conference call, tremendous recurring revenue, which obviously we want to make money, and we also wanted to, obviously, we have a mission. Your mission is to help women survive, thrive, but you also, this product actually does quite well for shareholders.
Yeah, it's part of the magic of our company. You know, our purpose is to enable healthier lives everywhere, every day. And our passion really is being global champions of women's health. You know, I happen to be very lucky in combining business with a strong sense of purpose. Our employees, they wake up every day. You know, I got a call at 10 o'clock Friday night last week at the end of a long week from the president of our breast health business. He called me at home just to say, hey, there was a small group of R&D engineers that had taken a project themselves that had been languishing. It wasn't even theirs. And he called me literally at 10 o'clock at night, Jim, to just tell me, hey, these guys think they've cracked the code on this project that's been really kind of going nowhere for a little while and really complex. And they just did it on their own. You know, and that's what you get when you have a company where everybody cares and we're fighting for our sisters, our mothers, our daughters, you know, everybody. You know, everybody's affected by women's health.
I was going about something else involved in the earnings, but I want to pivot to this because I think you have to explain to people that's actually highly unusual. You and I have been around. We know that most people that go to work and they feel a sense of purpose, but 10 o'clock at night, a breakthrough, that's quite different from what we've experienced in business.
It is, and I think, you know, it's part of what I think being in healthcare is one thing, but truly transforming women's health. And, you know, there is just an incredible passion. And what's been fascinating, too, is as our technology keeps advancing, it's probably like the iPhone. If you think about the iPhone, right? All the things it's enabled where, like, would Uber exist without the iPhone? No. Well, with our 3D mammography, one of the other things that's really become much more apparent is women's breast density. And the fact is a lot of women, about half the women have dense breasts. Those have always been very hard to read on mammograms. But with 3D, you can actually read them so much clearer. So we are actually the first product that's been approved and cleared by the FDA for dense breasts.
Okay.
So it's another one of these that, you know, and then that gets our engineers that much more fired up. It gets our clinicians, it gets our customers, the radiologists, you know, and they start telling us about all the patients who they've been finding more cancers in earlier so they don't need mastectomies, but we can just go in and do minimally invasive surgery. And it is magical.
Well, it's one of the reasons why I'm so glad you're here. No, because the awareness, people may not even know that this exists. My executive producer, Regina Gilgan, was also saying, listen, you really got to ask about the biomarkers. It's not, and it wasn't in the conference call. So this is something that you should talk about because, again, if we can get awareness, we can get people to realize that that this is no longer a horrendous process. It's obviously not good, but horrendous process.
Sure. We've got, lots of different things, but one of the new areas, and it's enabled by the technology, what we're actually getting into is what we call breast conserving surgery. And so one of the acquisitions we made last year is of a technology called BioZorb, which is a resorbable little marker that now if a doctor is going to go in and do what's traditionally known as a lumpectomy, and then we need to do radiation treatments, we can mark the exact spot without having to do, traditionally, it would be a mastectomy and, lots of radiation. Now we can do very targeted treatment. And in this case of BioZorb, the product is put in, it allows the marker, and it eventually absorbs back into the body after a couple of years. So you have something that helps you in the short term, and then there's no surgery required on the back end. So we're able to take what used to be, mastectomies, turn them into minimally invasive surgeries, treatments, everything so that the patient can end up, in a much better place. And by the way, it's also a lot less costly to the healthcare system.
Well, look, this is all terrific. I mean, I'm glad you came on because I think a lot of people just feel that everyone's just making money off the healthcare system and not improving people's lives. Hologic has always had that great reputation, and you're preserving it. I want to thank you for the women in the audience, but the men too, for everybody. Okay, that's Stephen McMillan. He's the Hologic Chairman, President, and CEO. I don't know about you, but I wish more people knew about this, and I'm glad you could come on the show. Mad Money's back after the break. Booyah! Jim Cramer here from Mad Money. Thanks for watching CNBC on YouTube. Click here to subscribe and get the jump on my exclusives with CEOs, plus market news, investing advice, and a whole lot more.